This is Carolyn with Superior You. I am finishing part of my series for having DCIS / breast cancer, stage 0. I got the surgery on Thursday, and it turned out to be a little bit better than I had ever anticipated. There's really something to be said for hospitals outside of Manhattan. It turned out that I didn't need that biopsy where you're on a table and you can't see what they're doing. They put me in a chair and rolled me up to the mammogram machine and did a mammogram and then gave me some lidocaine and guided a wire to the area. There were 4 people in the room for a guided wire mammogram. They couldn't get the wire in the first time in the right place, so they did it again. It was a lot less stressful than not being able to see what they were doing, because at least I could see and I was a part of it. And the nice nurse that was there the first time was there again, which made me feel good. And then, of course, the minute it was over, I started crying, missing my mother, who's passed since '98. And the nurse gave me a box of tissues, and I'm like, I don't know why I miss my mommy, but I do. And so I was reduced to a 11-year-old for 5 minutes. And then they took you to a private room by wheelchair, which was amazing. And my sister got to be with me, and my friend Ava came, and we hung out, and the anesthesiologist actually came to the room, which is unheard of in New York, and talked to me. And then I met her assistant, or her doctor fellowship, who's learning to be an anesthesiologist. And then the surgeon came in, and the nurse that was going to be in there. So basically it was a full room, supposedly. And then I figured their guides were there, and then my guides were there, and all my family that had passed. So I think I had a full house in that OR. And then I woke up in recovery in a nice private room again, where I got apple juice, and it was the best tasting apple juice with ice I've ever had in my life, with vanilla cookies and a graham cracker, and it was perfect. And then we got some food, and we went to Subway, and I went right back to bed for 3 hours. And the only negative that I've had experienced is some tenderness. I didn't really need any narcotics. I bought the prescription, but it was a waste of money. I only took 1 pill, and it made me nauseous, so I just switched to Tylenol. And then I have just been a little nauseous all weekend. My stomach hasn't been right, and there was some internal issues. My system's not functioning as well as it should. So hopefully that will go away, and tomorrow or Tuesday the latest, I'll find out if I have to go back for a second surgery if they didn't get all the edges. I feel confident that they did, because what happens in the OR is they send pictures back upstairs to see if they got it all, but it's still cells, and so until a pathologist says that the edges are clean, there's no way to know. So there is a chance that I might have to go through this again. And it was unfortunate that the day before work was so stressful, and that work was being so stressful, but they did wish me well before I went, and hopefully things will get back to normal next week. And these are stressful times, and trying to start a business to be healing myself through this kind of breast cancer, and also working is hard. So know that if you ever have to do all of it together, it's doable, it's possible, and you could just have to kind of take 1 minute at a time. So with that, I hope you have a great day. Thanks for watching my videos, and hopefully the next installment will be about that I'm fine and I get to go on to do radiation, and this will be put behind me in 4 to 6 weeks from now, when I start doing radiation for 6 weeks. So thanks, and take care. Have a great day.